Weather we've had recently has raised some questions about just how hardy we are here in the state of Florida. With some more insight on that is our medical specialist here at News Channel 5, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center when he's not here with us. So the old wives' tale that you always hear when you move here, I've been in Florida now almost 8 years, but you still hear it. Your blood thins out when you move here. True or false?
It's got to be one of the most common myths in the history of Florida, right?
You hear it everywhere.
I think everybody has said the same thing at some point. And when we talk about thinning of blood, by definition, that means either your blood can't clot or anemia. And one thing that's very, very clear, the warm weather does not do either of those.
So we're not all anemics here
in Florida.
Okay.
Exactly. We're not thinning our blood.
Good.
However, there is some physiologic changes that do occur. Number one is that there actually has been some studies that show that your estrogen does bind to fat cells, and it creates sort of a fatty insulation.
Oh, great. That's great.
If you're a polar bear or a seal or a Clevelander, right? You might have that insulation around you. Also, blood vessels on the skin, they dilate to release heat when you're in warm weather. And so it takes time for you to reacclimate when you get back in the cold. And so you can become less cold tolerant. So when that occurs, no insulation. Put on a coat.
You put on a coat. There you go. Doctor's orders. I like that. All right. Our next question, a little more serious in nature, not really relating to the cold, but at what age do you start losing your memory?
Yeah, it could be scary. I mean, when people start to forget certain things, it tends to frighten them, and believe it or not, there is some normalcy to this. In your 20s, you start to lose brain cells that can help with memory, and they slowly start to deteriorate throughout your life to where maybe in your 40s, you may notice that you're forgetting names, forgetting some numbers. I don't remember where I put my keys, things like that.
I walked into that room and why did I come in here?
You bet, but it doesn't affect
I have that already.
You. Yeah, but exactly. We all sort of do, but it doesn't really affect your day-to-day life.
Yeah.
Dementia, however, is a more rapid destruction of those brain cells, and it does affect your day-to-day life. You really cannot live without the help of somebody else. Then you can tell you may be having a problem. So the signs I want you to look for are if you're having trouble learning new things, if you're forgetting things that you do or have done many times before, okay? Or if you're repeating phrases in the same conversation, could be an indication.
All right, some good tips there. Thank you, as always, Dr. Soria. If you have a question that's on your mind you'd like to pose to the good doctor, you can send it to him through our website, WPTV.com. When you get there, just click on our health link. It's right there on the right-hand side. We'll be checking back in with Dr. Soria next week, and we'll see you folks right